All right, so on this video, we're just going to do kind of a potpourri of different tests for different potential injuries of the foot. So forefoot and then midfoot, and the forefoot again is your phalanges, and then the metatarsals, and then the midfoot is the three cuneiforms, the cuboid, on this side, the cuboid, and then on the medial side, then the navicular, okay, and the three cuneiforms. So that's your midfoot. So sometimes athletes come in and they, maybe have some midfoot, I'll say dysfunction or whatever, where they may have sprained that midfoot. So I just have a couple tests that I like to do. Sometimes I just, grab the ankle like this and provide kind of like a in this case, since I'm going out this way, it would be then a kind of a varus type of test. So I kind of like valgus varus with the midfoot, where I'm just kind of stressing it that way. And then I actually even try kind of like a torsional type of movement to that midfoot. There's those five tarsal bones in there, and a lot of ligaments that help support that area. And sometimes they can be injured, and so I'm just stressing that midfoot to see if it causes any more pain to the athlete, to kind of, again, confirm maybe suspicions of some midfoot dysfunction there. Also, then we start looking at what's called the base of the fifth metatarsal bone right here. Okay, and so the styloid process and the base of the fifth metatarsal, there's a potential for injury where we can get an avulsion, where maybe the peroneus brevis tendon that pulls right off of the styloid process right here. So now that's where I'm at with my finger right here, where I'm on the styloid process. It's easy to find, so that would be an area that you'd want to palpate if they complain of lateral foot pain over here, there. And then what you'd want to do from the styloid process is just kind of work your way in a distal direction onto the base of the fifth metatarsal bone. And at the base in this area is an area where the athlete can actually get what's called a Jones fracture. Okay, and so a lot of times just palpating and I'm pinching the bone, or sometimes I come down here where I go actually to the right here, the head of the metatarsal, and I actually kind of start to bow it. So I'm actually trying to take that bone and kind of like, put a lot of stress on it and bow it. And if that elicits pain, and it depends upon where the pain is. I mean, if it's pain under my finger, then that's different than being pain down here at the styloid or around the base of the fifth metatarsal, okay? And then the other area we talk about are the areas for stress fractures, potentially the second, third, and fourth, and right here, second, third, and fourth metatarsals. And it's not really on the heads of the metatarsals, but it's on the neck of the metatarsals. So same thing, I'm gonna pinch that metatarsal head, and then I'm gonna work my way proximally to where that neck is, and I'm going to palpate those areas, and I'm going to actually pinch really hard, and I'm actually going to pinch, and I'll even kind of like try to bow the the bone itself. And when I say bow, I'm actually taking it, I'm really trying to bend it, I'm trying to bend the bone. And so I'll do that on the right here, the fourth, the third, and the second metatarsals, and the neck of the metatarsal. Okay, and then last one, just kind of like real quick, kind of another kind of dysfunction or potential injury is going to be the infamous turf toe. And the turf toe is an injury to the first metatarsal phalangeal joint. And it's easy to stress that joint by, you can feel where the first metatarsal and the proximal phalanx come together, and you can actually kind of take that joint and you can manipulate it. I'm kind of sliding it, in this case, kind of anterior, then posterior, or in this case, the dorsum of the foot, dorsal, and then plantar, the plantar surface. I can also take that and actually even distract and pull apart. And again, all that puts stress on the joint capsule. And if the individual does have a turf toe, they've sprained, then usually part of the joint capsule and the ligamentous structures that support it. And usually the most common way that an athlete gets a turf toe is from, and I'll just do it this way, is from the hyperextension. They can also hyperflex like this, but the hyperextension is the more common. And so what we would do is then just take that great toe at the first metatarsal phalangeal joint into hyperextension, and stress it. That may elicit more pain, and it kind of gives us an idea of what's going on. Obviously, with all your injuries, though, you got to get a really good history to find out exactly what the athlete did. But if you know your anatomy, and an athlete points to a certain area where it may be painful, or they're just having symptoms there, it helps us identify what's going on. Okay, so again, those are just kind of like just a potpourri. It's not every single test. It's just kind of showing some different things. The last thing too is just to kind of identify this. Some people like to use the tuning fork as a way of looking at the potential for stress fractures, where you hit it and then you put the tuning fork right on the bone, and the tuning fork causes the bone to vibrate, and that vibration can cause an increase in pain. And so it's just, again, another tool. Doesn't mean that this is always a positive thing, and there are different size tuning forks that cause actually even more vibration. We can also use that on the shin splints and the potential for a stress fracture, but we'll talk about that one at a different video. Okay, cool.